Identify where you want to have the midline using the face and opposing arch as reference. Try the Easdent tray in the mouth. Teeth on the Easdent trays are standardly positioned, not custom designed. Normally, the maxillary teeth should have about 2 mm horizontal overlap and intercuspitated at proper position with the mandibular teeth. Easdent arch may be too wide or too narrow for the patient. They may not occlude evenly with the patient's teeth. The occlusal plane of the Easdent teeth may be tilted when occluding with the existing arch. Patient's interocclusal space may be too small, and the patient may not be able to bite down to the pre-measured VDO. To fit the Easdent tray better for the patient, you can soften the tray in the hot water at 65 degrees Celsius or 149 degrees Fahrenheit. Put the Easdent tray in the mouth. Pull the tray wider or push it narrow to match the width of the opposing arch. Then hold the Easdent teeth occluding with the opposing arch at the correct midline and horizontal overlap. When the tray is still soft, let the patient bite down at centric relation until a little bit beyond the pre-measured VDO. This will give enough interocclusal room for the tray and make the teeth occlude better with the opposing arch. If the horizontal plane of the Easdent tray is a little tilted, or the teeth cannot be put at the correct position and cannot occlude well with the opposing arch, you do not have to worry about it. As long as you can get the correct centric relation and get the VDO close to what you want, with the help of clinical pictures or face scan, you can give the lab instruction about the incisal position, midline, occlusal plane's height and angle in reference to the teeth on Easdent impression or the teeth on the opposing arch. You can let the lab increase or decrease VDO if necessary. Since maxillary dentures are more important for aesthetics, if you want to let the patient better see the cosmetic result using the Easdent tray and feel the bite better, you can use the articulating paper to find the high spots and grind down there to level the occlusal plane and make the Easdent teeth occlude better with the opposing arch. However, this adjustment is not necessary. If you provide enough information and instructions with the help of clinical pictures or face scan, the lab can set up the dentures correctly. You also have to look at the tray coverage at the posterior area. Feel with your finger to see if the tray is covering the hemialar notch areas for the maxillary arch and the retromolar pad area for the mandibular arch. Feel how much adjustment might be needed. If the tray is too long in the posterior area, you can cut some away. If the tray is too short, you can add extra moldable material at the posterior area beyond the tray to make sure your impression will cover the hemialar notch area and retromolar pad area. Also, evaluate how much space between the tray and the tissue. This will give you an idea of how much moldable material should be put on the tray initially.